Morning, everybody. Welcome to IDD Awareness Day Policy webinar. We're really excited you're joining us today. I'm Sandy Friedman. I'm Director of JFK Partners, and there are just a few housekeeping items I want to go over before we get started with this great webinar. Please keep your audio muted during today's presentation. We plan to reserve a few minutes at the end for questions and answers, and you could also write your questions into the chat. A recording of this webinar will be posted on the web and on the Alliance IDD Awareness Day site, and there's a link below on the slide. And finally, please join us on March 20th to watch the IDD Awareness Day virtual luncheon live. And you also could see this link on the Awareness Day webpage. So IDD Awareness Day, can we go to the next slide, please? It's hosted by JFK Partners, the Alliance, the ARC of Colorado. JFK Partners is Colorado's University Center for Excellence in Developmental Disability and Leadership Education and Neurodevelopmental Disability Program. Our mission is to promote the individuality, inclusion, active community engagement, and health and well-being for all people of diverse backgrounds with developmental disabilities and their families. Alliance is a nonprofit statewide association of community center boards, provider agencies, case management agency, strategic partners, and advocacy network members dedicated to strengthening services and support for people with intellectual and developmental disabilities. The ARC of Colorado provides system advocacy, public awareness, community education, and support for self-advocacy organizations across the state for persons with intellectual and developmental disabilities and their families. The ARC of Colorado is a state chapter, and across the state, we have additional 14 local chapters. Now I want to introduce the presenters for today. Next slide, please. Okay, I already introduced myself. Ellen Jensby is the Senior Director of Public Policy and Operations at Alliance. Elizabeth Moran is the Executive Director of the ARC of Colorado. Meredith Henry is a Senior Policy and Advocacy Associate at the ARC of Colorado. Unfortunately, she's not well today, so Elizabeth is going to fill in for Meredith. The bulk of today's webinar is being done by policy experts at Alliance and the ARC of Colorado.
All right, thank you so much, Sandy.
Okay.
Are you ready? I will take it for the next couple of slides. So I'm going to cover today's agenda briefly. First, we're going to talk a little bit about Developmental Disabilities Awareness Month. The month of March is always DD Awareness Month. Well, and then I'll cover a few important budget actions that the General Assembly is considering right now for the next state fiscal year. And then Elizabeth's going to cover a number of important bills related to people with IDD and their services. And then finally, our last section will be a section about how you can get involved in legislative advocacy at any level, no matter how much time you have. Next slide, please. All right, so first, as I mentioned, March is Developmental Disabilities Awareness Month, which is an annual event that started in 1987 when President Ronald Reagan proclaimed it as Developmental Disabilities Awareness Month. And it's designed to raise awareness about the inclusion of people with developmental disabilities in all facets of community life, as well as the barriers that they still sometimes face. And we've had a few events already this month. To kick us off on March 4th, we held a webinar announcing the finalists for Direct Support Professional of the Year, Case Manager of the Year, and Advocate of the Year. And those winners will be announced on March 20th during our Awareness Day luncheon. And then on the 7th, just last week, a number of disability advocacy groups came together and hosted Disability Rights Advocacy Day at the Capitol, which was a big success. And then, of course, coming up on the 20th is IDD Awareness Day to close out the month. So those are just Colorado-specific events. There are things happening around the nation. All right, moving on to some important budget items to be aware of in this legislative session. I'm going to cover 4 different things: the direct support workforce, case management redesign, and some of the complications and challenges that we're all experiencing related to that right now. The waiting list for people with for the developmental disabilities waiver, and then finally some advocacy around pediatric behavioral therapies. Next slide, please. Excuse me. All right, so starting with the direct support workforce, this is something we've covered every year for the past few years, but for those who aren't aware, direct support professionals are workers who assist people with disabilities to lead fulfilling lives in the community. They do a diverse range of supports and activities. They may help people get ready in the morning, take their medication, find a job, and give them on-the-job supports. And they help them participate in social activities, among many other things. So as you all may be aware, the pandemic worsened long-standing challenges to recruit and retain direct support professionals and created some service gaps. We are sort of slowly beginning to see the crisis that we were in the past few years subside a bit, which is great news. But as many of you are, I'm sure, aware, minimum wages across the state and in some of our local communities, including the city and county of Denver, they increase every single year. And so provider agencies are challenged to recruit and retain enough direct support professionals as they are competing with many other industries for those same workers. So how can the General Assembly help with this issue? Well, every year for the last couple of years, we have increased pay for direct support professionals in line with the minimum wage increases that happen. And so this year, the proposal is to increase the minimum wage for direct support professionals to $16.55 per hour all across the state. Right now, that base wage is set at $15.75. So that's an increase of almost $1 every hour. And then in the city and county of Denver, the minimum wage is actually higher. And so the proposal is to increase the DSP wage to at least $18.29. And I should be clear that in many areas of the state, direct support professionals are already paid above these minimums, but these are set as the base. And then, of course, in order to compete, those wages may need to be higher in many areas. And then additionally, the General Assembly is considering a 2.5% rate increase for all other Medicaid services. So every year, they set a specific percentage rate increase that applies to all Medicaid. And right now, the JBC is the Joint Budget Committee, sorry about using the acronym there. They are considering a 2.5% rate increase. So we'd love to see that supported to help increase pay for a variety of different services, because the targeted base wage increases only apply to certain services. And then additionally, they're also considering a 2% provider increase for early intervention services. So that would allow all of the professionals who provide early intervention, such as physical therapy, occupational therapy, speech language pathology, to also get a provider increase, or excuse me, a pay increase. Next slide, please. All right, moving on to case management redesign. And those of you who are intimately familiar with the system are no doubt hearing or feeling directly the pain associated with a number of different systems changes that are happening at the same time. And at Alliance, we have dubbed this the perfect storm of service disruption. So the four different systems issues that we're experiencing right now are: first, case management redesign. This is a process that the state has been engaged in and working on for a few years. They have selected new case management agencies to provide case management for people on disability waivers moving forward. And they've divided the state into new geographic regions that those case management agencies will cover. So there are a handful of community-centered boards that are continuing on as case management agencies, but the majority of those who used to provide case management for people with IDD are moving into only service provision now. And so there's been a lot of disruption with people needing to be transitioned from one case management agency or community center board to a new case management agency, which has created, unfortunately, a lot of confusion and technical hiccups. At the same time, the federal public health emergency came to an end, and the public health emergency had allowed people to stay on continuous coverage under Medicaid for the time of the public health emergency. And now that that has ended, the state of Colorado is mandated to do eligibility redeterminations to make sure people still qualify for Medicaid and the services that they receive. And unfortunately, amid having to do thousands of eligibility redeterminations, the county eligibility sites are experiencing significant staffing shortages. So they're short on staff, but very high on workload right now. And that's creating significant delays and sometimes causing people to lose eligibility even when they shouldn't. The third systems change that we're experiencing is the implementation of a new case management data system. And so in tandem with case management redesign, the state wanted to update and improve the data system used by case managers. Unfortunately, this has resulted in a lot of technical challenges, as any major data system shift will. But this is creating errors in the data that case management agencies and case managers are getting regarding the people that they're supposed to serve. They're getting new lists of people that they're supposed to serve every week, and sometimes they change dramatically from week to week. So those case managers are having a really hard time getting a handle on exactly who is supposed to be in their caseload. And it's also creating a lot of delays because the functions that used to take case manager, let's say 20 minutes or half an hour to do, are now unfortunately taking sometimes twice or three times as long. And so they're really struggling to catch up. All of these three systems changes have exacerbated long-standing shortages and high turnover among case managers. So this is a profession that is very challenging. And we have often heard from people receiving services that they get new case managers often, and that it's challenging to develop those long-standing relationships required for quality case management. And so unfortunately, because of the tumultuous nature of their job right now, we are seeing even higher turnover. So what is the result of all these changes? As I mentioned before, people are getting essentially kicked off of Medicaid even when they shouldn't be, because of either technical glitches in the system or delays at the county eligibility sites to get their eligibility continued. They're experiencing gaps in case management. So either they may get a new case manager who they've never met before. They may actually be sort of stuck in limbo and not know who their case management agency or their case manager is right now. And so they may have to call around and try to ascertain who that is. It's been incredibly challenging. And then, of course, case managers are the sort of gateway into services, and they are required to approve services for people with IDD. And in fact, people with disabilities across all of the various waivers that they're serving now. And so when there are these significant gaps or systems issues that prevent them from doing that, people may experience gaps in services. So there's been mass confusion on all sides. Case management agencies and providers are struggling to operate because all of these technical issues are creating um, problems with them being able to get reimbursed for services that they're providing. So there are actually breaks in payment. And of course, in order to keep going, they have to be able to pay their staff. So this has been a major struggle. And importantly, the most um, concerning result of this has been the potential loss of critical daily supports for people with IDD and other disabilities. So moving on to the next slide, what can the General Assembly do to help with this problem? Well, thankfully, our partners at the state Medicaid agency have proposed a stabilization funding plan that the Joint Budget Committee, who is the sort of legislative committee that has to approve all of the proposed budget items every year. They've proposed something for them to consider. And so they'll be considering that this week on Wednesday. The stabilization funding plan would help provide case management agencies with funding to hire and retain their staff to handle the significant backlog that exists in doing, new service plans, or every year the continued stay reviews for people who are on waivers, and just maintain their operations. So hopefully help them keep all of those case managers who are very close to walking out the door. This plan would also allow the department to hire 2 additional staff to provide technical assistance with the new case management data system and oversee the implementation of that data system and the many fixes and improvements that it needs. And this would also provide funding, sorry, one more bullet on that side, to pay the state's contractor for the data system to help fix those issues and make enhancements to the system. So we're urging the Joint Budget Committee to approve that plan this week. Next slide. Moving on to the waiting list elimination. As many of you know, out of our state's, I think, 10 Medicaid waivers that we have at the moment, the developmental disabilities waiver is the only one that still has a waiting list. And so although there's been a lot of progress in recent years and thousands of people have been offered enrollment into this waiting list, we do still have a few thousand who are still waiting. During this perfect storm that I just covered, we are cautious about adding a significant number of new enrollments into the system, but we do want to continue to make progress on eliminating the waiting list. So we're asking the General Assembly to fund at least 129 new DD waiver enrollments next year. So the state fiscal year starts on July 1st. So that's when these new waiver enrollments would become available. And 129 seems like an odd number, and it is, but that is a number that would trigger a population-based enrollment methodology that the state uses. And that would ensure that every region of the state gets at least one enrollment. So what's happened over the years when we haven't had at least 129 new enrollments every year to trigger this is that there are so many people in our metro areas of the state that most of the people coming off the waiting list live in these metro areas. And what that means is that there aren't as many people coming off of the waiting list in rural areas. And that simply makes it difficult for our rural providers to sustain services, because if they don't have enough people that they're serving to maintain staffing for those services, then those will slowly deplete over time. That's why we're asking for this odd number of 129, and the Joint Budget Committee is still considering this proposal as well. Next slide. Finally, pediatric behavioral therapies is a specific subset of services. These are primarily provided to people who are receiving services through the Medicaid state plan, not a waiver. But these are services for people who are 20 years old and younger to assist them with behavioral needs. There have been changes in how the state pays for these services, as well as chronically low provider rates over the past decade or so. And this has resulted in a significant shortage of providers. So many of the providers have to limit the number of Medicaid enrollees that they accept. And some of them have actually closed their doors or left the state altogether in recent years. And so the state has been considering rate increases to help solve this problem this year, and the governor proposed some. And the Joint Budget Committee is currently considering proposals to increase pediatric behavioral therapy rates in alignment with other states that have similar services so that we can compete in the market and keep those providers here in Colorado. All right, next slide. And I think I am turning it over to Elizabeth to cover bills. Thank you.
Thank you, Ellen, and thank you, Sandra, for the kind introduction. So we're going to go through several bills. Next slide, please. 6 of them are bills that we're going to talk about a little more in depth about, and they are bills that we hope that you will support. And then when we finish going through these 6 bills, there's a list of about 6 or 7 additional bills that we think are important for you just to keep on your radar. Next slide. So we'll start here with House Bill 24-1063. For those of you who aren't familiar with how House Bill titles read or the numbers there, so HB means House Bill. If you see an SB, that means Senate Bill. The next 2 numbers indicate what year the bill was introduced, in some case passed. So House Bill 24 means 2024, and then 1063 is the number that's associated with this specific bill title. On each of the following slides on the right-hand side, you'll also see a list of the sponsors of the bill. Those are the legislators that are bringing this before their committee and trying to get it passed. They are your primary contact. However, I would encourage you to look at the bill and find out which committee it's in or just where it is in the legislative process. That will help guide where you would be most effective doing your advocacy. Each of these slides, you'll see where it says, on this slide in particular, it says House Bill 24-1063. That is a live link. And so when you're looking at these slides after this event, if you click on that link, it'll take you directly to the information on this particular bill. So let's jump in. This first one is around addressing abbreviated school days. This clarifies what constitutes an abbreviated school day and effects on students with disability. It requires the Department of Education to implement a policy that explains, among other things, when are abbreviated school days permissible, a review of abbreviated schedules on a regular basis, information sharing with parents and guardians or custodians of school-age children, and documentation and records about abbreviated school days. It also requires additional data collection and reporting to the General Assembly. This bill came out of a community engagement tour last fall where we and Disability Law Colorado and CCDC were hearing from all over the state of Colorado that students with intellectual and developmental disabilities were being denied their free and appropriate public education. And because of those staffing issues that Ellen discussed a little bit earlier, and then also just perhaps not having the funding or capacity to handle challenges during the school day, students were being asked to go home early when it was not part of their IEP plan, and or parents were being asked just to keep their children home. So very important bill here. If this is something that you have firsthand experience in, and this is going to be true for all of our bills, if you have lived experience in any of these areas, I would encourage you to consider providing either written or oral testimony, talking to legislators, and you can do verbal testimony either in person or online. Next slide. Ballot access for candidates with disabilities. This is House Bill 24-1067. Of course, being an election year, this is a particularly important bill, and you can see it's got 4 very strong sponsors there on the right-hand side. So what this bill does is it addresses persistent barriers that are faced by individuals with disabilities when they're seeking public office and just participating in the political processes themselves. It requires the General Assembly, the Secretary of State, and Colorado political parties ensure that accessibility for candidates with disabilities in the caucus process or any future alternative for ballot access are able to engage in meaningful ways in those processes. It also requires that within 6 months of the bill's effective date, There's an option for individuals to participate in precinct caucuses or party assemblies through video conferencing unless it's being held in an area without broadband internet service. Really, what this bill is intended to do is to ensure meaningful engagement by all people, creating some equity, particularly around effective communication, accommodations, and supports in the ballot access process, but just in the political process itself. Next slide. House Bill 24-1165 is a bill that looks at Denver airport accessibility. So the ADA, as we know, has been in place for nearly 34 years now, but what we're finding is that there are certain public spaces like the Denver airport that are still lacking in true accessibility. So what this bill does is it mandates accountability around mutually agreed upon timelines, that is working with the Denver airport for securing basic access in very specific areas. It sets up an advisory committee within the airport to support expanding and improving accessibility features as the airport continues to grow. For any of you who've been to the Denver airport lately, there's lots of construction, lots of renovation, and lots of changes that are being made. And so what this bill asks them to do is to consider really digging in around accessibility and making sure the airport is travelable for everyone. It mandates that certain minimum accessibility features, including wayfinding features and accessible bathrooms with changing tables, are in each concourse. Next slide. House Bill 24-1167 is a bill that prohibits student seclusion. It prohibits the use of seclusion on a student by a school district, a district charter school, or an institute charter school. It requires the Colorado State Board of Education to create rules that prohibit seclusion. It requires the creation of a resource bank of materials regarding alternatives to seclusion and restraints, and it amends the current reporting requirements to ensure incidents of seclusion are reported. Next slide. House Bill 24-1168 is around equal access to public meetings. So this bill requires that state and local public bodies ensure accessibility requirements by July 1st of 2025. It requires that public meetings have a recorded vote, or where public testimony is heard, it must be accessible in real time. This includes, but it's not limited to, live stream video or audio that is recorded and accessible to individuals with disabilities. It allows participation in meetings and testimonies by video conferencing, and it provides for auxiliary aids or services. Really, what this bill does is it just takes Title II and Title III of the ADA under effective communication, which are federal requirements, and just more explicitly states that equal access to these meetings, the ability to have effective communication supports and to meaningfully engage in public meetings is stated in Colorado law. Next slide. So this is the last bill that we will cover in depth. This is the Uniform Guardianship and Conservatorship Act. It's Senate Bill 24-136. So currently, under Colorado law, we have the previous version of what is called a Uniform Law Commission Act, or the Uniform Act. It has not been updated in the state of Colorado for over 23 years. And while we've made significant progress in the state of Colorado, providing amendments or updated pieces that relate to guardianship and conservatorship, this will be the first time in 23 years that we've done a comprehensive overhaul or an update of the Uniform Guardianship and Conservatorship Act. This act prohibits guardianship where less restrictive alternatives meet that adult's needs, and it really puts less restrictive alternatives such as supported decision-making or integrated supports at the forefront of creating supports and accommodations for an individual. It requires less restrictive alternatives be tried, and it also requires in the petition itself that the petitioner states what has been tried and what has failed and or why. It clarifies that the lawyer for the respondent, the person who would be subject to guardianship or conservatorship, must represent the adult's wishes. We recently did a survey and received 113 responses that indicated that often the lawyer who is appointed for the individual who has the cognitive disability will not just represent the individual's wishes or their will and preference, but may also defer to what we call the best interest standard, which means that they represent what they believe is in the best interest versus the adult's wishes. And ethically, an attorney is required to zealously advocate for the wishes of the individual they are representing. The bill includes a section around interested persons and notices and information that must be provided to interested persons. So these are people who are particularly close to the individual who is subject to the guardianship, who may be involved in their day-to-day life. Sometimes the guardian isn't necessarily involved in their day-to-day life. And what it does, it expands the circle of folks who receive important information and notifications about that individual when those go out, rather than those notices just going to the guardian and then those individuals having to rely on the goodwill of the guardian to share that information. It requires the court be notified of any restrictions to visitation or relationships that last more than 7 days, particularly for family members. Some of the stories we heard in our survey and going across the state was about guardianships who would cut off contact for the individual who is subject to the guardianship or conservatorship with their close family members or friends, sort of their inner circle, because of conflicts that were happening between the guardian or a host home or someone that it didn't involve the family member and the actual individual, so there was no risk of imminent danger or harm. It was really about personalities or other things that were going on sort of at that higher level. So the new Uniform Act would prevent sort of cutting off family and friends for more than 7 days without notifying the court and giving a justification. My favorite part of this bill is it clearly states what the rights are of individuals who are subject to guardianship or conservatorship, and it removes Ellen, I'm going to chalk it up to daylight savings time again. It removes stigmatizing language such as ward and incapacitated or incapacitate. I think we all know that incapacity is not necessarily in total, a person is not totally incapacitated most of the time. And so what this bill does is it recognizes that a person might have capacity in one area of their life, but not another. And so by removing the word incapacitated from the act itself, it helps us mitigate that challenge and those assumptions that are made that if a person is under a guardianship, that they are completely incapacitated. Next slide. So additional bills we think it's important for you just to keep an eye on. There's a list here, House Bill 24-1019, around the Crisis Resolution Team Program. This bill, sort of the short summary of it, is it helps provide some funding and some ongoing resources for crisis resolution teams to help keep folks out of, keep law enforcement involvement down, ER visits down, and really help parents and family members and folks who are supporting an individual who may be in crisis have some tools at their disposal to mitigate those challenges. House Bill 24-1034 is around adult competency to stand trial. House Bill 1115 has to do with prescription drug label accessibility. This is particularly important for individuals who have visual impairments. It creates access to and requirements of pharmacies when an individual needs a support or an accommodation where a label would be read to them or providing alternative effective communication supports for drug accessibility. This is also important for individuals who have intellectual and developmental disabilities or related cognitive disabilities that affect their ability to read and understand what's on the label. But if they were told frequency, how many, sort of what you need to know around how you take your medications. Also a great bill that improves accessibility. House Bill 24-1161 has to do with motor vehicle access for individuals with disabilities. House Bill 24-1316 creates, this is a brand new bill that just got introduced last week, a Colorado Disability Opportunity Office for ongoing work around disability rights and advocacy. And then finally, House Bill 1318 is around modifying rental premises for persons with disabilities. What this bill does is changes current requirements around having individuals who have modified, for instance, a leased property, having to incur the cost to put that property back to the way it was previously at their own expense. Next slide. And with that, I'm going to turn it back over to Ellen.
All right. Thanks, Elizabeth. Just give you a little bit of a break here because you're covering a lot of slides. Thank you for that.
Of course.
So if anyone is curious about other bills that you may have heard of this year that we didn't cover, you can check out our online bill trackers, and these are updated in real time on a daily basis based on what bills are being introduced and the positions that our organizations have taken on those bills. You can find additional information and links to the full text. So if you want to learn any more about the bills we talked about today, or just what else we're tracking throughout the legislative session, please visit those websites. And also, I should just note that additional bills are being introduced throughout the session, and we are maybe roughly halfway through. I'm not sure if we're officially halfway there, but we're getting close. Okay, next slide, please. So now we're going to cover a little bit of legislative advocacy and how you can get involved in the legislative process at any level. And I think, Elizabeth, we had you slated to do all these slides, so I'll let you take it away. If you get tired of talking or need a water break, I'm happy to pinch it, so go for it.
Thanks, Ellen. And actually, I'd welcome you or Sandy jumping in for any of these. So feel free to just jump in. So what we've done is we've arranged these next few slides sort of as beginner advocacy, intermediate advocacy, and advanced advocacy. So we're going to start here. For those of you who may be new to legislative and public policy advocacy, these are things that you can do in a very short period of time, 2 to 15 minutes. So the first thing we would encourage you to do is find out who your representatives are. You can do that by going to the web links that are listed here. The ledge.colorado will help you find your Colorado legislator. All you need is your home address, your place of residence. You type that in and it will pull up a list of your legislators, and it'll also give you their contact information. That second link you see there is to help you find your federal legislators, those folks who live and work in DC and do work on our behalf, help you find who they are, get some contact information from them, and I would encourage you to look them up. Connect with the organizations you trust. So for instance, Alliance, JFK, the ARC of Colorado, some of our other Disability Rights Network partners at CCDC, at the Disability Law of Colorado, lots of organizations across the state that can give you timely, accurate, and reliable information and can tell you what's going on at the Capitol, what's going on in policy, what's going around some of those really important issues that Ellen talked about earlier around case management design, our shortage of direct care providers and workers, Medicaid. Follow them on social media, sign up for newsletters, respond to action alerts. Register to vote. Your vote means something. It's the way we tell legislators what we like, what we don't like, and who we want to be representing our voice on the Hill, both here in Colorado, but also in DC. And then finally, program your elected officials' contact info into your phone. Most of our elected officials will give you their direct and personal cell phone number. They want to hear from you. They want you to sign up for their newsletters. They want you to come to their local town halls. So once you have that contact information, put that information in your phone. So as issues arise, you can contact them right away. Ellen or Sandy, anything you'd add?
No, you're good.
No, you were great.
All right, next slide. So this is what we consider sort of our intermediate advocacy, things that can take as much as 15 minutes or an hour or more of your time. Look up how your legislators voted on important bills. So there are bill trackers, or what we call scorecards, on almost all of our disability rights advocacy organizations' web pages. That includes us, the ARC of Colorado, and Alliance. Look those up, find out who is supporting what, and then certainly drop them a thank you. Let them know that you are paying attention and you see when they are supporting disability rights associated legislation. Let them know you're thankful for that, and encourage them to continue doing so and being champions on behalf of our stakeholders. Call or visit your legislator to discuss issues you care about and share your lived experience. You don't have to necessarily do that here at the Hill in Denver. Often our legislators have local offices. You can meet with them in your hometown, grab a coffee, go for a walk, be creative. So, sometimes they like just to sort of break that norm where it's not necessarily a sit down meeting around a table. Meet them at one of your local favorite coffee shops or a lunch place or a park, go for a walk. Lots of things you can do to visit and have conversations with your legislators. And then finally, writing a letter to the editor of your local newspaper. That can be on an issue that you are particularly passionate about. It might also just to make sure that your local newspaper is putting out information about events, whether those are town halls or meetings or a particular piece of legislation or events like our IDD Awareness Day that is coming up on the 20th, making sure that your local newspaper knows what's going on and can help you to spread the word. Next slide. And then finally, around advanced advocacy. These are things that take a little bit longer. So the first one you'll see is attend or testify at a hearing on a bill of interest to you. So I talked about this a little bit earlier when we were talking about those specific bills. It's so important for those legislators, not just to hear from the professionals or the lobbyists who are at the Hill, but also to hear from all of you. They want to hear lived experience, and the only way that they can have context, so hear how a very particular bill will impact the Colorado citizens and the people that those legislators care most about. They want to hear from you. They want context. So you can find the Colorado session schedule, the link that's provided on this page. And if you don't have access to this particular slide deck, you can always just Google Colorado legislator schedule, or how do I attend a hearing? How do I provide testimony with the Colorado legislature? It'll pull it up for you and take you to those links. There are also lots of public testimony options. You can appear in person. You can appear by writing a letter to a committee or a legislator. And you can also appear online via a Zoom link that is provided by the Colorado legislature. You can attend or host a candidate forum or town hall or another educational opportunity and ask that legislator about their stance on issues that are important to you. I think that stakeholder engagement, your engagement, at town halls and other what we call candidate forums, gatherings they have, informational meetings, is one of the most important things you can do. I've been to, I think, 7 town halls just since January. And in my experience, they are often attended by anywhere from 10 to 20 people up to maybe 80 people. They are the perfect opportunity for you to have a one-on-one conversation with your legislators, your representatives. They often invite leadership, local community leadership, so you're able to meet with them as well. But it's a great opportunity for you to share with them your story or to talk to them about the why. Why are you so passionate about a particular piece of legislation or an issue? I would encourage you to create a lasting relationship with a legislator by being an ongoing resource for them. Sometimes we get in the role where we're just asking them for things, right? I want you to do this for me. I want you to do that for me. I want you to come to this event. I want you. And, I believe we have a responsibility for what is called reciprocity, right? To make it a two-way street. Let them know, give them your contact information. Let them know if there are areas of expertise that you can help them with. Let them know if you know of resources for data or resources for an expert in that area in your district. Be a connector, be a source of information for them. And then finally, volunteering to help a candidate, help the cause or help an organization. We are all of the disability rights organizations across the state of Colorado, and I think that includes all of us here on this call. We are small but mighty teams. And so when we have events or gatherings or gather folks around a specific cause, including that testimony we talked about earlier at the Capitol, we rely heavily on volunteers and folks like you to join our efforts and to help us make our events successful. Ellen or Sandy, anything else you might add to that last slide?
No, I just want to repeat something that you said, which is that legislators appreciate hearing from us as professionals, but they love hearing from people in their districts who have lived experiences or are, directly impacted by the policies that they're considering at the Capitol. So um, even though it can be intimidating to reach out or stand up at a town hall and ask a question, just know that they are public servants and you are the people that they're hoping to hear from.
I
All
have
right.
really nothing to add other than people with lived experience and their families. So I think involving families is really important too.
Great. Thank you both for that. All right, Ellen, I'm going to turn it back over to you.
All right. Thanks, Elizabeth. So that is it for the content that we're going to cover on today's webinar. Of course, this was just a little sliver of the policy work that's ongoing all during session and that our organizations do all year round. So if you have any additional questions that you'd like to ask, you can feel free to reach out to us, but we did reserve a few minutes for Q&A today. And just as a reminder, the slides and a recording of this presentation will be posted at the IDD Awareness Day website. So you'll be able to go back and access all those links that we put in the slide deck if you'd like to find those. And then, of course, don't forget on the 20th to mark your calendars for noon. Come back to that webpage, to our Facebook page, and you can watch our IDD Awareness Day luncheon live and hear more from all of our speakers and the announcement of those awards that I mentioned earlier. I don't see any questions in the chat, but at this point, if you'd like to ask a question, you're free to unmute yourself or type it into the chat and we will try to tackle those. I'll just give the awkward silence just a few more seconds in case anybody is having technical difficulties like we all did today. All right, well, hearing none, we'll go ahead and close out the webinar. And again, the offer to answer questions via email still stands if you think of something after the fact. But we hope to see all of you on the 20th at IDD Awareness Day, either in person or online. Thank you so much.